ACE inhibitors. These are angiotensin converting enzyme inhibitors. So uh, we have to know how these where is this angiotensin is produced, what is the action of these inhibitors, what is the action of ACE um, enzyme itself. So what happens is when our blood pressure drops, renin will be secreted from the kidney, and it will activate angiotensinogen to angiotensin 1. So these angiotensin 1 will go into bloodstream, and next right atrium, right ventricle, pulmonary arteries, and they go into pulmonary capillaries, and there they will convert into angiotensin 1 to angiotensin 2. These angiotensin 2 will constrict the blood vessel and increase the blood pressure. So that is what happened. So angiotensin converting enzyme is work on converting angiotensin 1 to angiotensin 2. This enzyme will using our drugs, ACE inhibitor drugs, we block the function of the enzyme, so it will remain as angiotensin 1, not convert into angiotensin 2. So the function of angiotensin 2 will be ceased. So uh, another special function of this angiotensin converting enzyme is it um, convert active bradykinin into inactive bradykinin. So when active bradykinin accumulate due to ACE inhibitors, it will cause cough reflex, cough. So it is a typical side effect of ACE inhibitors. um, so angiotensinogen is produced from the liver, you have to know. So when liver diseases are there, angiotensinogen production will be impaired, and if there's renal impairment also due to renin uh, um, secretion impairment, also it will be reduced. So it is mainly this is the system of renin, angiotensin, aldosterone system, right? So we block angiotensin 1 converting into angiotensin 2. So the function of angiotensin 2 will be impaired. So normally these drugs are good for congestive heart failure because they dilate both arteries and veins. Due to dilation of the arteries, it will reduce the afterload. Due to dilation of the veins, it will reduce preload. So again, mechanism of action: block conversion of angiotensin 1 to angiotensin 2, hence decrease preload and afterload. Mnemonic: you have to remember the all ACE inhibitors drugs end from prils. So there's a mnemonic: partial puncture technique. P for perindopril, uh, R for ramipril, C for captopril, E for enalapril, L for lisinopril, Q for quinapril, T for trandalopril, F for fosinapril. Um, so all ending with prils. Indication: congestive heart failure, hypertension, myocardial infarction, coronary artery diseases. Coronary artery diseases, we use ACE inhibitors. Mostly ACE inhibitors use very famously in hypertension. So if you in your family members who take drugs for hypertension, there should be ACE inhibitors, and most often as a side effect they will cough. So if cough is there, you could change into angiotensin receptor blockers, ARBs. So side effects: mnemonic is top card. ACE inhibitors are teratogenic. It will produce orthostatic hypotension, and it will cause hyperkalemia, and it will cause dry cough, and it will cause angioedema, and also renal impairment. So that is that those are the ACE inhibitors you have to know. So ACE inhibitors are renin, angiotensinogen, and next angiotensin 1 it's converted to angiotensin 2, and it decreased payload and afterload, and mnemonic is partial puncture technique. All are ending pills. Indication: mainly hypertension, congestive heart failure, myocardial infarction, coronary artery diseases. Mnemonic is top teratogenic, orthostatic hypotension, hyperkalemia, and dry cough, and angioedema and renal impairment.